HTR, HRT? What the F is HRT? So I'm so glad you're back, and it is just always such a pleasure to have you here with us. We've discussed perimenopause, we've discussed menopause. Now I need to know, what the F is HRT? HTR, HRT?
HRT, MHT, HT, even the terms are confusing.
Yeah.
No wonder people are mystified.
Yeah.
So Jeannie, today we don't talk about HRT anymore. The term is MHT, menopause hormone therapy.
Okay.
And that's the correct term to use. So,
Great.
yeah, what is it and where do we start?
Yeah,
It's a
exactly.
big topic. The first place to start is that every woman is going to go through menopause. It's going to happen to us all. So when the time comes, we are all going to be faced with this question, well, do I use hormone replacement or not? Mm-hmm. And I think the important thing is that we truly debunk, understand, demystify the benefits and the risks of what hormone therapy is all about, so that when every woman gets to that point in her life, she's making the best decision for herself. There's no right or wrong decision. It's a completely personalized, individualized decision, but we must be fully informed either way.
Yeah.
So we've got to know our hormones, we've got to know what they're going to do if we take them, we've got to know what we could be missing out on if we don't take them. So whatever our decision is an informed one.
So I know hormonal treatment before, was a roller coaster of reputation.
Yeah.
Like one day it was great, next thing it gave you breast cancer and everybody hated it.
Correct.
Where are we today with it?
Oh, we are totally evolved. So
Okay.
in the early 2000s, there was this big scare around hormone replacement therapy. And as you said, sort of the world went dark on hormones. It causes breast cancer. We can't do this stuff. And women worldwide stopped. Doctors stopped prescribing it. And it's quite sad because it's left us with a legacy today and a taboo around hormones and breast cancers that we're desperately trying to reframe, which we're going to do today. The hormones that were studied at the time were much older hormones. They were synthetic hormones.
Okay.
And we now understand, 20, 25 years later, that there are different types of hormones, and different types of hormones matter. They actually matter. Hormones are like fruit. So a hormone is a hormone, a fruit is a fruit, but you get different kinds. You get apples and bananas and oranges, and they're totally different. An apple is green, a banana smells different, and so too do different hormones behave differently in the body.
Wow.
Yeah.
So, how do you know what hormone treatments you need then?
You have to know the difference, the basic differences, which we'll talk about, and you have to ask your practitioner what you're getting or what you would like to get. It's so important. There are different kinds of hormones in that some are more synthetic and some are more natural and look and are kind of exactly the same as what the hormones are that you've made your whole life. So that's really the place to start, because they differ so much in terms of what they do, how they make us feel, what their side effects are. So for example, some might give us more weight gain. No woman wants that. Some give us more acne. Some give us more mood symptoms. But there are also more serious side effects that can come with certain hormones. So where the science has evolved is that different kinds of progesterones, particularly synthetic progesterones, may even increase our risk for breast cancer more than other kinds. So this really changes the playing field when it comes to what hormone treatment we decide to choose. So it's not just about side effects, there are different risks, and each woman must ask her practitioner about all the side effects, all the benefits, and the different kinds of risks as well.
And there's so many bioidentical kind of treatments as well. How do you know, or do the creams and the patches and the pills do different things?
They do. So we know that it's not just the type of hormone that matters, it's also the way you use it. So if we use estrogen on the skin, it behaves differently to if we take it in the mouth.
Oh, wow.
So if we take estrogen by mouth, we have a higher risk for clotting. The oral contraceptive pill, which has got in estrogen, and we kind of all know that there's a higher risk of clotting. It's the same with estrogen replacement after menopause. But if we deliver it via the skin in a cream or a patch, it takes that risk of clotting right down.
Amazing.
So the way we use hormones matters, and the type matters. Interestingly though, we must be careful of creams because, for example, after menopause, estrogen as a cream or a patch is fine and maybe actually more beneficial from a safety point of view. But we don't want to use progesterone as a cream. So we need to be very educated and discerning. We can get progesterone creams sort of over the counter, and in fact a lot of women inadvertently are putting themselves at risk.
Totally. I mean, that's such a high risk thing. Even myself in my bathroom, I wouldn't know what creams I'm grabbing. I would just grab and rub. That's scary.
Absolutely. So a good general rule of thumb, there are many different kinds of hormone replacements out there, and each woman would discuss with her doctor. But if you are going to use estrogen and progesterone should be in a tablet form.
Okay.
And estrogen could be in a cream form or a tablet form, but could be in a cream form. No progesterone creams after menopause if you're on estrogen. That's really important.
And are these treatments recommended? Like, would you say to any woman who's going through menopause, you absolutely need hormone replacement or menopausal treatment? Getting my terms right.
Dr. Jeannie, you do so well.
I look better in a nurse outfit, but I mean...
I'm blushing.
Should everybody be on, anyone going through menopause, should they be on the treatments?
No, so we can't say hormone replacement is for everybody. There's some women who unfortunately just can't use hormone replacement. So for example, if you've unfortunately ever had breast cancer before, it's not an option, and you would need to consult your doctor and chat about other options. And there are many other options, non-hormonal options for menopause. So please don't think that if you can't do hormones that there's no help for you. There is. But I think what we should be saying is, let's understand hormones better. Let's understand that the risk of breast cancer is not what we thought 25 years ago.
Yeah.
And let's reframe that a little bit, because what societies like the International Menopause Society are saying in their guidelines is that for most women, most of the time, if appropriate, there can be far more to benefit from hormone replacement than the risk of breast cancer, which is smaller than we thought. So we need to just be teasing out the discussion around, well, look, hormones can really benefit your heart. We don't think about that. So we're avoiding the breast cancer risk, but are we putting ourselves at risk of dying younger from heart disease because we haven't used the hormones? It's a much more rounded, bigger debate, and women really need to sink their teeth into the discussion and understanding.
And if you find yourself that you are in the middle of menopause and you are taking the treatments, is it a forever thing that you have to be on, or is it a short term, let's get through this, 12 months, boom?
Oh, that's a great question. No, the shorter duration of treatment is also older thinking. That is no longer the recommendation. Today we say that women can use hormone replacement for as long as they need. So what that means is that potentially one could be on it lifelong if one needs it, if one is having hot flushes forever into your 90s, it can be used as a therapy. Health is a journey, it evolves. So every year you should be seeing your practitioner, you should be catching up on where you are from a health point of view and reviewing all the time. So as long as the benefits of treatment are still in your favor and outweigh your risks, it could be a great idea to continue.
And what is your take on holistic approaches and castor oil on your thyroid to try and save?
Oh my goodness.
Don't try anything that I do at home.
She's not a real doctor. Don't listen to her. She's a genie in a bottle, though.
Yeah, exactly. But are there kind of holistic treatments? The hippie in me is just trying to find some.
There are loads of offerings out there. Not many of them are really robustly studied, of course, but some may have some merit. And some herbals can be helpful in the shorter term for things like hot flushes. But just remember, when we talk about treatment, what are we trying to achieve? We're not just trying to treat hot flushes here. That's a superficial goal.
Oh,
We're
that's
trying to
tiny
treat the
compared to the
whole
rest.
woman. Yeah, we want to look after your heart, your brain, your mental health. We want to protect your bone density. You know, herbal medications are not proven to do that like hormones are. So, you know, there can be, again, with misinformation, a loss on quite a lot of the benefits that hormones may have to offer. Having said that, if women elect not to do hormone replacement or they can't, what I feel very, very strongly about is the conversation for menopausal care should not just end there, which I'm seeing. I'm seeing women being turned away, saying, look, you don't want to do hormones, there's nothing more I can do for you. Nonsense. Then we go, okay, Jeannie, how are we going to protect your bone density? Do we need to look at vitamin D? Do we need to look at calcium? How are we going to protect your brain? What is your diet like? Are you getting enough omega-3 fatty acids? There is a role for supplementation, but I feel it should be assistive to hormones if we're going to do hormones, or at least really sensible, right?
Yeah.
So really, really sensible and as sort of efficacious as we can be. So we just got to be selective about the supplements that we do.
But now you just drove me into panic because I'm not yet in perimenopause, but now it's bone density and stuff. Should I be already taking extra vitamin D, taking my creatine and all collagen and all these other things now? When it does come time for me to go through the change, I know my bone density is going to be fine, my muscle mass is going to be fine, I'm going to sail through this.
So I think first things first, at this stage of life, you want to be looking after your muscle mass and your bone density through exercise primarily. Vitamin D, if your levels are low, you can supplement with vitamin D. A bone density test, which women must start doing after the age of 50.
Yeah.
But if you're in your early 40s or late 30s or even mid 40s, exercise, resistance training, core strength, getting enough protein in your diet. By the way, preserving that muscle mass is also so critical for weight and metabolic health because it drives our metabolism.
Yeah.
And as we age, so if we want to think sort of in a more forward way or in a proactive aging way, we lose muscle mass with age. It's an inevitability of the aging process. But you know how I feel about fighting back. So we're going to gym it up.
Exactly. Doubling up on Pilates.
Exactly.
Thank you so much. I feel like we are just so enriched and are losing the fear of going through the change. So thank you so much for dispelling all the myths and fears for us.
You're very, very welcome. There is truly nothing to fear. It really just is about a navigation and then just having fun with your life.
Never fear when Dr. Simone is there.